So thank God facelifting is back. It should always have been back. It's one of the reasons I went into aesthetic surgery in the first place. Let's not talk about the 4 horsemen of the apocalypse, but let's talk about the 4 facelift techniques. Your surgeon should be able to do all 4. So today I think it's very, very important, especially timing-wise, to discuss facelifting. Facelifts are one of the main reasons I got into aesthetic plastic surgery, along with rhinoplasty back in medical school when I had aspirations to be where I'm at in life. Now, facelifts will always, in my opinion, be trending because it's one of the quintessential procedures or operations plastic surgeons have performed for years. So many celebrities and Hollywood royalty from around the world, kings, queens, princesses, for over 50 decades have been getting facelifting. Facelifting now, the cool thing about it is I feel like it's made a comeback. It's made a comeback in the past year or two. Not just because of recent press in New York City, but just recent advances in techniques and more surgeons learning how to do these techniques. Because of all the conferences we do now through Zoom, through streaming platforms, surgeons are venturing and doing more of the facelift techniques that I think should have been done all along. Let's talk about the different types of facelifts. The first type of facelift, which is my favorite and I think is the most powerful facelift, was actually created by my mentor, one of my main mentors in facelifting, Dr. Fritz Barton. It's called the high SMAS facelift. High SMAS means that the elevation of the SMAS, which I should explain. The SMAS, S-M-A-S, stands for the superficial muscular aponeurotic system. That is basically, it looks a little bit like a cheese pizza when you lift it up. It has the muscles of the smile muscles, it has some of these zygoma muscles, all these muscles of the face intertwined. The platysma sheet muscle of the clavicle going all the way up to the neck, which separates in people, it needs to be brought in, goes about up here, so it connects with it. So some people consider the platysma muscle to be part of this SMAS network. Now, what you do with the SMAS to me is everything. In my opinion, the majority of people would benefit when done properly with this most advanced technique, which is the high SMAS. Because the SMAS entry point and elevation point is above or at the arch here, you're able to recruit the entire face and cheek in a very vertical way. That is how you get that nice celebrity enhancement you're seeing right now. This is mostly for first-time facelifts. We'll talk about multiple facelifts and what happens with that later. So the high SMAS, popularized and essentially created by my mentor, Dr. Fritz Barton, back in the 2000s. He has an entire textbook right here. Illustrations will help you understand. It allows the SMAS to go vertical and lift the whole face. That allows this to recruit. You get the jowls 100% fixed, these jowls that age here. You get the neck draped because you get some of the SMAS and wrap it behind the ear. And it usually is involved with also a platysmoplasty, which we'll talk to. And more often than not, because you get such a nice vertical transformation in a very natural way, because the skin is not what we are tightening. If you're relying on the unreliable skin as your vehicle to lift the face, you're gonna have these weird reference lines pulling the mouth. You're gonna have the corner of the eye weird or up. You're gonna lift the nose in a weird way. You're just gonna make things look awkward, and that's not a true facelift. So high SMAS approach allows you to do vertical approach, go underneath, just like when you go in a hotel room and that sheet is so tight around the bed and you can't get under it and pull that sheet to go to sleep. If you don't release the sheet from its source way down there, you're not gonna get recruitment and being able to go to bed in that tight hotel sheet that they make so tight. In the SMAS situation, you have deflation of the fat compartments of the face. The SMAS is redundant, so you have to actually pull it tight. And the further you can pull it up, the higher, the more you can recruit this malar cheek fat pad, drape it up here, and get that gorgeous, elegant, natural, enhanced transformation. High SMAS, to me, is the most technically challenging and complicated procedures. I'm very fortunate to have trained and known this technique since the beginning of my training. So for me, it is, I don't want to say effortless, but it is really, to me, the quintessential way I like to do facelifting. The next less advanced, but still advanced technique is under SMAS, sub-SMAS procedures, the most common of which is a deep plane facelift. Most of the time, the deep plane entry point is a little low or in the middle here. So you can imagine if you're here, there's nothing going on here. So a lot of people compensate and do a lot of fat grafting to enhance this area and not lifting the face as vertical because the pull is not as high. they're entering here. You can get a nice pull, but it's not often as dramatic. When you look at some of these deep plane results, the neck and jawline is not as crisp and clean. The transformation is not as wow factor. Wow factor can be transformative, dramatic, but natural because we're not pulling the skin. Now, all of these go with nuances and artistry and being able to judge how much, where, what vector to pull. Vector means angle or direction. So vertical oblique vector is the most powerful one for most facelifting, both men and women of any age. Now, the next two techniques are the techniques that about 95 to 90% of surgeons worldwide in the United States perform, and that is SMAS plication or SMASectomy. SMASectomy to me is the one that I would use sometimes in someone younger who doesn't have a lot of jowls, who just needs a little tightening of the SMAS but doesn't need that much of a transformative facial shape change. They might be someone in their late 30s who lost a lot of weight from GLP-1 agonists or from a lap band or gastric bypass. It might be someone who's 45 or even close to 50 who just has genetically tight tissue, beautiful bone structure, and just needs recruitment of that SMAS through a SMASectomy where we cut a strip parallel to the nasolabial fold typically, but I still like to angle it a little more vertical. Remove that SMAS strip, put it back together and tighten the deep network, let the skin drape. That's a SMASectomy. It was popularized by Dan Baker in New York City. And interestingly enough, Fritz Barton trained in New York City, NYU, and brought a lot of these techniques and created them in Dallas, where I trained at UT Southwestern. So NYU in New York and Dallas really for a long time, multiple decades, were two of the meccas and the golden centers of aesthetic training for a lot of people doing facelifting and rhinoplasty and other things. So another notable person is my good friend Rod Rorick, who helped train me. He was the chairman in Dallas at the time that I was there, and I wrote this paper, Lift and Fill Facelift, with him, which really talks about a concept that almost everybody does now, no matter what facelift they do, which is filling with fat transfer, the fat compartments on different levels as you do a SMAS plication or SMASectomy. Or in this paper, you'll see some of the image of SMAS stacking. SMAS stacking is a little variation of SMAS plication. So thanks, Rod, and that is another technique that's a go-to. The last one is the one that people do a lot of the most commonly. It's the one that, some of these 1 hour, 2 hour facelift things, they'll pull a little skin, they'll go in, they'll plicate. Now you can do plication or what's called stacking or plication and get beautiful results. And it's one of the most common techniques, and in the right hands with the right vector angle, done well in the right person, can be transformative as well. So these are all the different techniques. However, once again, we go from complex and challenging and technically advanced all the way down to not so technically advanced, but still effective and does the trick. These transformations you're seeing right now are a variety of 3rd or 4th facelifts being done. When you're doing the 2nd, 3rd, or 4th facelift, usually it's a plication with a lot of laser resurfacing or a deep chemical peel, maybe some brow or eyelid work. But in general, the first time facelift, sometimes the 2nd facelift, if it's done through a high SMAS, which once again, very few people actually know how to do, I think that's really superior. It's kind of a deep plane plus because you're going high and you're going above the cheek fat pad. Let's finish with one other important point. The more you transform the face, the more you're going vertical, the more you're gonna have something to do with the brows, the eyes, to drape them naturally and nicely. That's why when you look at my results, you often will see an endoscopic release brow lift performed. I was fortunate enough to train under some of the gurus that created this endoscopic technique in the 90s. I didn't train in the 90s, but they created these techniques in the 90s. Bauman Gairon in Cleveland was one of them. He still does a lot of that and created migraine surgery from his endoscopic approach, and Dr. Steve Bird is another one. And then there was actually a Burbank surgeon, Greek surgeon named Nicanor Isse, who was another one. Gordon Sasaki. There were a lot of people really into this endoscopic approach. In my opinion, in my hands, I like to do endoscopic from here up, do a high SMAS from here down. When you recruit that up and you can release the ligaments of the brow and address this corrugator 111 muscle right, shape the brow, not even necessarily have to lift it, but you just shape it. You can really customize and individualize that brow shape to be synergized. Combined with that high SMAS vertical lift, you get a home run result. To finish up, I think it's important to understand you gotta go to a surgeon that knows how to do the technique that will work for you. You have to look at results, you have to talk to them, use your gut instinct. Does this person have the ability to deliver a customized approach for me? If someone walks in my door for a facelift, I can do a high SMAS, I can do a deep plane with multiple vectors, I can do application, I can do a SMASectomy. Now, the key thing is that I'll end with, if someone can do a high SMAS, it's like an engineer fixing a Formula One car. A Formula One car is highly advanced. The maneuvers you need to do are intricate, very extensive, very detailed, require advanced learning to do. You can't just come out of mechanic school and go fix a Formula One car. It's a whole advanced thing. That's a high SMAS. Fixing a Lexus SUV or just a good old 1990s Benz, still advanced, but it's not a Formula One car. So a high SMAS surgeon can do the other 3 techniques fairly easily, so they can deliver 4 techniques for you. But someone who mostly does plication or SMASectomy will have to go back and relearn or try to learn high SMAS or deep plane to transition to the more complicated. So it's like a Lexus engineer or someone fixing a Prius having to go do about a year or 2 or more of training to learn that Formula One engine or the high SMAS extensive technique. With that said, everyone approaching me asking about whether they should go to New York, whether they should go to Turkey, etc. To me, you have 2 coasts. You have Dallas, you have the 2 coasts. There's surgeons that deliver high SMAS in southern states and West Coast and East Coast. So it's really a matter of you talking to the surgeon and understanding that if you learn this terminology, hopefully your surgeon's honest with you. And if they can do high SMAS, they can do extensive deep planing, they can vector and go where you want, they'll be able to customize your result to what you deserve just for you and nobody else. Thanks.